Hello there, I'm your optician. My name is Hannah and I'll be examining your eyes today. I just want to check I've got the right folders. Let me just check your chart. Confirm your name and date of birth for me, please. Okay, and when was your last eye exam? Last night. Okay, perfect. And did you have any issues with your vision at that time? Okay. Do you wear any contact lenses, any corrective surgery for the eyes, any glasses, things like that? Okay. And is that up to date at this time as far as you're aware? Okay. Any pain behind the eyes, pulsing, headaches, things like that? A little bit of pain and pressure. Would you say it feels more like a throbbing, a stabbing pain? A throbbing, okay. And is there any time that feels worse than others? So, for example, like after a long day? Yeah, exactly, okay. A lot of computer time makes it worse. Anything that makes it better? Just resting, okay. Any blurriness, double vision? Oh, great. Any visual disturbances that you've noticed? Any little fuzzies floating around from side to side, or anything like visual disturbances like flashes of light at the corners of the eyes, things like that? Good. And any sensitivity to light? Does it make those headaches a little worse? Okay. So we'll check for astigmatism, things like that. With that sensitivity to light, we'll see if you're experiencing any splaying with the light refraction. But for now, I think I just want to go through a basic exam since we have not seen you here at this office yet, and be pretty thorough, and that way we can refer back to that tomorrow night, okay? So I always start every exam with a thorough inspection of the physical eye. So placing on my protective gloves, I am just going to be palpating around the eye. Any tenderness with this? Any tenderness with this at all? Okay, let's do this side. Any tenderness there? Okay. I want you to blink for me a couple times. I want you to look up. I'm just going to be holding, looking at the conjunctiva. Okay, and look down for me, please. Sclera is nice and white, pink and moist on the conjunctiva. So it doesn't seem like there's any excess tearing. I'm just going to press on those tear glands. Any pain with that right here? No? Okay. All right. I'm going to blow just a little bit of air into the eye. I'm looking to activate that tearing. Okay, I'm just looking at that eye now. Here we can patch you dry. Okay, and this side. Does that elicit any of that pressure in the back of the eyes? No. So we're getting normal tearing response, which is really, really good. I'll check for the blink reflex. So basically looking for the reflex in the eye. Okay, good. This side. Good. I'm watching the pupils as I do this too. Good. Good. Okay, that's all fine as well. So far the functioning of the eyes is good. The eye itself, taking a look at your eyelashes. Next, I've got a spoolie here, and this is just going to be checking for any loss of hair, any inflammation or tenderness in the eyelashes themselves. They're so close to the eye and to all the nerves and the functions of the eye, so we just want to make sure that they're healthy. So you'll feel it touch you lightly. And just look up for me. There you go. And look down. Okay. The same thing over here. Look up for me, please. Look down. Any tenderness while I'm moving this around? No. Okay. So the eyelashes look good. They look healthy and strong. There's no weakness at the roots. There's no discharge or anything like that. Alright, just a couple more reflexes here. So I want you to just try and ignore me. Looking for a reflex. Good. Now I'm going to tap on your forehead and I don't want you to blink. Good, good. Alright. So I can remove my gloves for the rest of the exam because we're done with the physical assessment of the eyes. And now I want to check the vision. So this is going to be the reaction of the pupils. First we'll just check where your pupil size is now. And I would say you're at about a 4, which is typical for the level of light in this room. So try not to look at me, just sort of stare back here at my chart. I'm going to be shining a light, and I want to see how that pupil size changes, both consensually and individually. So the direct reaction is good. I'm going to check the consensual now. Just keep staring back at that wall. Okay, shining it right above you. It's going to be reflecting in your eyes. I'm seeing where it's reflecting. It does reflect in the same spot in both eyes. So that's exactly what we want to see. I want you to stare just at this light here at the tip of this pen. It shouldn't be too bright. It shouldn't be affecting your sort of the aperture of the eye, but I want you to follow it everywhere it goes. It's going to go slow. It's going to go fast. And I want you to just keep your eye on it the whole time. Not me. Just keep your eye on this and don't move your head. Keep watching it. Everywhere it goes. Good. And I'm looking at your eyes, looking for the movement of your eyes. Are they signs of nystagmus, which is a flickering, or Any signs of double vision, cross-eyedness? Follow it all the way out there for me, please. Keep it there. Ignore my finger. Now, please look at my finger. Okay, a little closer, a little cross-eyed for you. Back at the light. And then look at my finger. Is that better? Okay. All right, back at the light. Follow it all the way in. Watch it go, watch it go, watch it go, watch it go. Tell me when it gets blurry. Right about there. Okay. Tell me when it gets clear again. Right about there. When it gets blurry. Right about there. When it gets clear. Good. How many fingers am I holding up over here? Try to stare straight at my nose. Straight at the light and tell me how many fingers I'm holding up. Okay. I'm going to do the same thing on this side. First, I'm going to hold the light over here. Try to stare at the light and tell me how many. Okay, and how about now? Can you see now? Checking the peripheral vision here. Okay. Which side is the light on? Good. Okay. Follow the light as it comes in and watch it move. Follow the light as it comes down. Up. Find the light as it comes in. Very good. Up and down. We're making an H pattern here to check the fields of gaze. Again, follow it in. Now look at my finger. Let your eyes adjust. Look at my finger. And back at the light. And back at my fingers. And back at the light. Alright, blink your eyes back. Blink your eyes back. Very good. I'm going to cover one of your eyes with this obstruction. And I want you to tell me when you see my fingers wiggling. Good. 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 Let's try the other side. Again, I'm going to cover you up just half your vision here. I want to just test this eye. And tell me when you see my fingers wiggling. Good. 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 Okay. I want you to touch your nose and then touch my finger. And back to your nose and then back to my finger. Back to your nose and back to my finger. Back to your nose, back to my finger. Touch my finger, then touch your nose. Touch my finger, then your nose. Finger, nose, finger, nose. Okay, so that's working on that hand-eye coordination, making sure the eyes and the brain are able to communicate. I'm going to be pointing to my chart here, and I would say that's about the right distance away. So could you please read this big letter for me? Perfect. So that was an easy one. That's line 1, so you should definitely be able to see that. I'm going to jump down to line number 3. If you could read that for me, please. Good. Okay. Now I'm going to jump down again 2 more. I'm going to jump down to line number 6. So this line, please. So here. Try that one more time. This line right here, right above the separator. And let's go up one more. Try this one. Good. Cover one eye and read that backwards for me, please. So cover one eye and read that same line number 5 backwards for me, please. And cover the other eye and read it forwards. Okay. So I would say right now you're at 20/40 vision. That's not the best. We definitely want to have that prescription adjusted because really, this line 6 and line 7 really should be still very legible for you, but it starts to get a little blurry between 6 and, can you see any of 7? Not too much of it, okay. So we'll definitely want to adjust that. Let's see if you have any color blindness. This one's kind of fun. So I'm using Ishihara plates. And just tell me what letter or number you see here on these slides. Perfect. That is 29. What about on this slide? Do you see a number here? What number do you see there? Very close, very close. I could see how you could switch that up because it's very similar. Okay, so let's try the green plates. You see a number here. Perfect. How about here? Okay, we'll do a hard one. You see a number there? Something hidden in there? Great. And what about here? That's perfect. Last one. What number do you see here? Take a nice look. Take a good look. Exactly. There is no number there, but if you could just take this and trace for me, that would be, from start to finish. I'd like you to trace for me. Okay, thank you. So yeah, I think your color vision is intact. Before I do my final test, which is to look into the back of the eye, I do need to dilate the pupils. This process can be slightly uncomfortable, but I do need to be able to see the pupils and the pupillary reaction a little bit bigger than just your typical size 4, which is where you're at today. So I'm going to be putting a couple of drops in your eyes, and you'll just take a second to adjust. Those pupils will start to dilate. It means it's going to get a little darker in here, and I'm going to take a look into the back of the eye, look at the veins, look at the red reflex, and look for any signs of precancerous cells or glaucoma or issues with the back of the eye, okay? So I'm just going to give a couple of drops to the back of the eye, and this doesn't hurt at all. It's just going to feel a little funny when the vision starts to darken. Dab that for you. Okay, so give it just a second. Your vision's going to start to darken. I'm going to get my light. I'm going to get really close with this one, right? Just stay still. It's okay. So it might take just a few hours for that vision to fully come back. I definitely suggest just closing your eyes, maybe laying down a little, relaxing, and then slowly you'll feel back to normal. I do want to refer you to a true glasses fitting session. I definitely think you would need that. You know, we were just checking the health of the eye today, but as far as your vision itself, your prescription's certainly out of date. So I can refer you to that, and you can have that done a separate time. But I'll just make a couple of notes and we'll have you on your way. So I would wear some sunglasses when you go outside so your eyes aren't super sensitive to the light, and avoid operating any heavy machinery just for about 2 hours. It doesn't take too long these days to go back to normal, okay? Any questions for me? Okay. Well, I will see you tomorrow, and I will go ahead and compare results again then. Thank you.